welcome to another episode of Ask the Doc. I'm your host, Jennifer Filzen, and today I have with me Dr. Dan McCarter of ChenMed. Welcome, Doctor.
Thanks, Jennifer. It's great to be with you today.
Oh, I'm so thrilled to see you. I've heard some great stuff about ChenMed. I understand that you are primarily focusing on seniors. Could you tell us a bit about your business and what your specialties are?
Absolutely, absolutely. We provide a concierge level care to high risk, underserved seniors in underserved areas, and our goal is to transform care for the neediest populations in the whole country.
That is remarkable. Okay. So to hear concierge service, which is high end, with underserved, which is low end, that's a beautiful blend. How does that work? Tell us about that business model and how are you able to do this wonderful work?
Well, we take full financial risk in the Medicare Advantage program, and so we get paid a set amount of money to take care of patients for the entire year, and the only way we can be successful is to keep them healthy and out of the hospital. And the best way we found to do that is to develop close relationships with their primary care physicians, and then for the primary care physicians to see these patients frequently. Our goal is once a month, so we average 10 times a year.
Wow, you are making the world a better place. Oh my goodness, this is great stuff. Tell me how you got involved personally with ChenMed and your role within the business.
Okay. Well, before I came to ChenMed, I spent 27 years at the University of Virginia, where I did a number of different things. I started a rural practice right out of residency, and I saw patients there for the entire time. And then later was the associate chief medical officer for all the outpatient clinics at UVA, and finally was the medical director and lead executive for a Track One Medicare Shared Savings Plan. And I but I got really interested in population health. I didn't think that the academic medical centers were going to get us where we needed to go, and I then joined ChenMed initially as the market chief medical officer in Richmond, Virginia, and then later it was clear that we needed to build relationships with more groups, and I moved into the role of the National Director of Primary Care Advancement to help with residency programs, medical schools that are interested in learning about value-based care and learning about our model, and to make it clear that primary care is a very good career choice for upcoming medical students and residents, and there are options besides just working for the large academic or hospital-owned health systems.
It sounds like a true win-win for everybody. The people coming into the field of medicine, they're learning a new way of doing things. The people who are less financially able to handle the more expensive, forgive me, I'm in Monterey, California. And of course, I have insurance and I have everything I need, but like I look at some of the bills and it's like, right? And we hear so many times that people are going bankrupt because they had a care provided and it cost them their house and that kind of
Right.
thing. And what you're doing is amazing. Could you share with us some success stories of how your program has benefited your patients and even the people coming into the medical field?
Well, absolutely. I mean, I think one is the doctors feel like when you're given panels of 2,000 patients, your schedules are just getting packed and you're not getting the opportunity to really get to know the patients. That
Mhm.
that's not a very fulfilling way to practice. So
Right.
the having the smaller panels and really feeling like you can make a difference and having time with them makes a huge difference for the doctors. As far as the patients go, very often prior to joining us, they haven't really had access to good primary care. They've been getting care where they can in medical, very often in the emergency departments, and that's not
Mhm.
a great place to get good primary care. So they have access to people who know them, who are going to see them once a month. There's that social interaction. We offer transportation for patients to come into the to come into the office to see our doctors, and then we also offer physician dispensing on site. So 80% of the time, we can give them their medicines that they're going to need when they leave the office, and they can take that home with them as well. Um, we also offer cardiology on site, and we offer acupuncture on site. So it can make a huge difference for people to have those interactions, have access to that care, and care that they really haven't had available to them in the past.
Bravo! Truly, truly, you're doing some great work. There are so many questions. So I would imagine that with the baby boomers, a very, very large population, they're moving more and more into their elder golden years, right? I would imagine that this program at ChenMed would be helping a lot of those seniors, yes, because not everybody has themselves set up well for retirement, right? And again,
Right.
one major medical issue could bankrupt you. So who is this open to? How do you qualify? Is it for the average person, or do you have to be in a specific socioeconomic strata to qualify? How does this work?
Well, I mean, Medicare Advantage is basically private Medicare. It was Medicare Part C. I forgot exactly which year that started. So anybody who's eligible for Medicare can turn in their Medicare benefit and take the private Medicare Advantage plan from one of the private insurers, United, Aetna, Humana. I mean, a lot of them are offering that. And then if they choose us to be their PCP, they can come to us, and the insurance company, if we've got the contract with the insurance company, then they can choose us. We take the full financial risk from the insurance company, and then we manage the patient's medical care and we manage the money. And if we do a good job of managing the patients, then that's the way we're able to make a profit. It is, in fact, open if somebody lives in the areas and they have access to one of the contracts that we do business with, that they have access to our care. Now, that being said, we focus on putting our centers in areas where there are high density, low income, underserved seniors. We our mission is to serve those most in need. But this
Mhm.
last year, 46% of Medicare patients chose Medicare Advantage. Now, that being said, most Medicare Advantage is still practiced in the fee for service transactional model rather than the transformational value based model that we do. Only about 4.5% of Medicare of all of Medicare is in a full risk model. So it's
Mhm.
somewhere about 10% of Medicare Advantage is in a full risk model.
Thank you for breaking this down for us. This is really fascinating stuff. So, do you ever get pushback from? Because again, forgive me, I'm not in your field. I'm just thinking way back years ago, back when I was selling health insurance, and I was hearing all about, the challenges between how a lot of insurance companies didn't necessarily want to cover all of the costs the hospitals face. And so they had this negotiation of percentages and such. And it was fascinating hearing how that worked. And this is back in the 1990s. So clearly my information is old. So do you get pushback, or do you find that with the way things are going, that people are more accepting, especially in the insurance world, of this type of model?
The insurance companies, these are groups of patients that are very difficult to manage, meaning that they have these complex chronic illnesses. They need this high intensity care, and there just aren't that many options open for them. So, generally, when we go into an area, the the insurance companies have invited us into that area, and so we are coming in. We're not coming in an adversarial manner. We're coming in because they feel like there is a need for our model of care in the areas that we're going into.
That is fantastic. Doctor, you are making the world a better place through ChenMed, and I'm so delighted that we got a chance to talk to you today. Thank you.
Absolutely.
All
Thank you
right.
for having me.
Yeah, for sure. Everybody, thank you so very much for watching today's episode of Ask the Doc. I hope you enjoyed meeting Dr. Dan McCarter as much as I did. And if you would like to find out more about what they're doing at ChenMed, please go to BuzzTV at iwannabuzz.com to learn more. Thank you so very much for watching, and we'll see you next time. Bye.